So today I'm going to show you how I do platelet-rich plasma prolotherapy on the shoulder. This patient has a torn rotator cuff muscle, the supraspinatus. He also has a torn labrum and has some arthritis in the joint. And he's having a lot of pain when he raises his shoulder. So what we're going to do, we're going to use that platelet-rich plasma to inject into the labrum, into the torn tendons, and into the joint, and we're going to try to heal it and give him some function and hopefully pain relief. First, I'm going to start off with marking the landmarks and find some of the pathological structures. Here you can see there's actually a tear in the labrum, and that's going to be one of our targets. So I'm going to numb up some of the area with some lidocaine. That will help to make the injection less painful. And all it is, I'm just injecting underneath the skin. So what I'm doing right now is marking the landmarks for the front of the shoulder, for the front injection, and finding my injection area for the labrum. I'm able to get into the labrum here by injecting between the coracoid process and the humeral head. So I'm numbing up the area that we're going to be doing the injection. There's some lidocaine and ropivacaine going right into that. There's the PRP. This is what we're going to be using to inject his joint and the labrum and the tendons. It's nice and yellow. It doesn't have any red blood cells in it, and that's a good quality PRP. So what I'm doing now, I'm injecting. I'm actually using the ultrasound to get into his joint and into the back of that labrum. I'm going to go right into that joint, and we're going to go ahead and inject into the joint, which is going to cover the labrum, which is going to cover the cartilage and all the ligaments on the inside as well. And you can see on the ultrasound that my needle is right in the middle there. There we go. So now what I'm doing is I'm injecting that labrum from the top of the joint, and that allows me to get the superior component of that labrum and help it heal a little bit. So I'm injecting the supraspinatus right now. That's where his tear was on that MRI. And if you look on the actual ultrasound, you can see that the needle is inside a tendon, and it's actually in a tear, and we're getting a nice spread of the PRP inside where the tear is. Perfect. Okay, you can see my needle going into the tendon and opening up the area where the tear is, and it's going to go right into that tear right there. And you can see the tear actually spreading open a little bit. So now next, I'm going to be injecting into the labrum. I'm getting the needle in between his humeral head and the coracoid process. And the idea is to get it right onto that labrum. And that's where his tear is. Next, we're going to inject the AC joint. He's got quite a bit of arthritis in the AC joint, and you can see that joint very nicely on that ultrasound. And we'll just put the needle in between that joint, and you can see the needle in there. I'm going to fill that joint up with some PRP. That's going to help with some of the arthritic pains that he's having. Okay. You also want to get the coracoid process, so where a lot of important tendons and ligaments attach. And it helps to stabilize that joint. Now we're also going to get the bicep tendon. He's got some tendonitis of the bicep tendon. So now I'm injecting the bicep tendon, and you can see the fluid spreading around the bicep tendon. And it's going to help with that bicep tendonitis that he's feeling. Okay, I'm going to go right next to the bicep tendon, and I'm going to inject where the glenohumeral ligaments attach that help to stabilize that joint. All right. So now I'm done with the PRP injections of his shoulder. We've injected all our targets, the joint, the labrum, the tendons. And the next thing for him is to go home and heal. So the healing is going to take place for the next 3 to 6 weeks. And we're hoping that he's going to improve in his function, and the pain is going to decrease as well.